دوستی فصل قشنگی است پر از لاله سرخ. دوستی تلفیق شعور من و توست. دوستی رنگ قشنگی است به رنگ خدا. دوستی حس عجیبی است میان من و تو. با تشکر از اینکه یک بار دیگه با ما هستید در یکی از برنامه‌های آیپا. مهمون این هفته ما آقای دکتر نیما امجدی هستن که من دیگه بیشتر از این صحبت نمی‌کنم، میسپارم به میترا جون که بقیه صحبت رو بگم. میترا جون بفرمایید.
سلام عرض می‌کنم خدمت بینندگان عزیز این برنامه. خیلی خوشحالیم که دوباره یک شب دیگه از سلسله برنامه آیپا در خدمت شما هستیم. امروز مهمون بسیار ویژه‌ای داریم از فرهیختگان جامعه ایرانی در آستین، آقای دکتر نیما امجدی. So happy to have you, Dr. Amjadi. He is a physician with a specialty in interventional cardiology. So welcome. Thank you for being our guest. Could you please talk about yourself? Tell us more about you and your practice, please.
My name is Nima Amjadi. I'm a cardiologist. I have been in practice in Austin for 17 years, but we started our new independent private practice here at the beginning of this year, and we try to provide patient-centered care.
That's great. So can we have to know, what insurances do you see? Do you see private patients?
We see pretty much all insurances. There's some smaller ones that we may not have, but all the big ones we're contracted with.
Okay. I have some bunch of questions here. If we can go through them and just see how much we can cover. What is the primary and secondary prevention of cardiovascular diseases?
Primary prevention is trying to keep the first event from actually happening. Secondary prevention is when someone has an event, then you try to prevent it from happening again. So one is maybe more proactive and one is reactive.
And the other question I have, what are the causes or risk factors of cardiovascular disease?
Well, we don't know that full answer. There is 7 or 8 risk factors that we know of. And when we apply all of those risk factors to the population as a whole, we still only identify about half the patients who get heart disease, which tells us there's a lot we don't know. But the more common ones are things like blood pressure and cholesterol and smoking and being overweight and poorly controlled diabetes and not exercising and eating fatty foods.
Great. And what is the role of bystanders to assist someone with acute coronary symptoms?
With acute coronary syndromes, the first objective is to actually recognize it, right? There's a reason we call heartburn, because half the time it's your stomach and half the time it's not. So being able to get folks to actually understand the symptoms going on and distinguish between something minor, like reflux disease or heart disease is first, and then getting people to not delay getting care, because getting a prompt care for an acute coronary syndrome can really mitigate some of the long-term consequences.
Okay. Do you like to add anything to this? Like anything to say? There's any age that you recommend the patient come, or just for prevention, or?
Complicated question. The average age of a heart attack is decreasing in the US. It was 64, now it's down to 61. But we have to apply these criteria to individual people, right? So depending on the patient's family members, at what age they had, and the risk factors can alter that age. But we generally start looking and addressing the risk factors fairly early on. We know that some of the risk factors like cholesterol even begin to be problems as early as the teenage years.
Yeah, that's right. And some of them are like from the genetics, like they have the high cholesterol. And
yeah, there's no question. And for years, the genetic cholesterol people were ignored. We didn't really have a whole lot of good treatments. Today we do, and these people who typically have very bad cholesterols have some very effective treatments, and we've shown that by treating them early, we can prevent them from actually having their first event.
Yeah, and do you think obesity or like the diet that people have that could also affect that?
Without question, obesity is an epidemic in this country.
Yeah, that's right. So that can increase the risk.
Without question.
Yeah. Do you have any question, Leandro?
Yeah, you mentioned the average age of the heart attack went from 64 and now it's 61. So what can people do at home to help prevent that? What can they do with their diet, maybe daily behavior?
So I mean, we can take each of the individual criteria we talked about. Diet, a plant-based diet is much healthier than one based on animals. One that is free of processed sugar, nitrates, processed meats, preservatives, salt. These are all important factors. Salt relates to things like blood pressure, regular exercise, control of weight. Um, in Iranians, a Mediterranean diet is much healthier than you know the standard meat and potatoes diet. Control of other risk factors, cholesterol, getting yearly checkups and things like that.
Right. Let's go back to practice. Can you just briefly let us know that what procedure besides doing the exams you do in your office?
We are a comprehensive practice. We try to provide all the general aspects of you know interview assessment. We do non-invasive tests like stress tests and ultrasounds of your heart called echocardiograms. We can screen for aneurysms in your belly. We can check the circulation in your arms and legs. We can check for blockages in your carotid arteries. We even implant little recorders under the skin that allow us to do long-term rhythm management. And our hope is that within the next few years, to be able to offer more invasive procedures that are currently offered at the hospital as well. But right now, we do basically all of that.
That's amazing. If you just let me, I'll explain some of them in Farsi for
Sure.
our Persian audience. یا همونطور که آقای دکتر فرمودن حدود 3 تا لوکیشن دارن در آستین که از معدود دکترایی هستن که با هاسپیتال کار نمی‌کنن و بسیاری از پروسیجرها رو در مطب خودشون انجام میدن با نرخ بسیار پایین‌تر از بیمارستان. بسیار فلکسیبل هستن، اینشورنس های زیادی رو می‌بینن، پرایوت پیشنت می‌بینن و با بیمار میتونن راه بیان. بسیار هزینه ها کمتر در میاد براتون وقتی که به ایشون مراجعه میکنید تا زمانی که به بیمارستان مراجعه بکنین. و در انتها حتما ازشون میخوایم که آدرس مطب و اینستاگرام و فیسبوکشون در اختیار ما قرار بدن که شما عزیزان بتونین حتما در اسرع وقت برای چکاپ به آقای دکتر مراجعه کنید. علیرضا جان یه بریک به ما بدین، یک با صدای قشنگتون با موزیک زیباتون لذت ببریم. خسته نباشید آقای دکتر. Thank you.
مرسی.
Thank you. دکتر یه چیزی که خیلی متداوله، من فارسی میگم چون خیلی از دوستای معلمی میگن معمولا میگن یه قلب خیلی خوب داره، دستشون قلبش خوبه، قلبش صافه، ولی بقیه قلبشون کجه، مثلا یه قلبش صافه یا چقدر اصلا مربوط به قلب میشه، مهربونه آدم هاشه.
Actually, Farsi,
kind.
we call that a spiritual heart.
یعنی که spiritual heart شما مریض نمیشه که هارت خوب باشه. دوستان سعی کنید هارت خوب باشه. خب خب چون تعدادی بعد زیاده دکتر مشتریش داره تعدادی هارت خوب کم. خب من یه قطعه در ماژوره اینجا میزنم که برای دوستانی که انگلیسی زبان هستن یکم آشناتر باشه این ملودی. با موسیقی ایرانی که آشنا هستن نمیشه کم هایده گوش
مامان بابا هایده گوش بگیرن.
من اتفاقا به من گفتن که بخوایم بریم که دکتر قلب هستن. من قبل فکر کردم ما چه آهنگی داریم که برای قلب باشه، هیچ آهنگی یادم نمیاد توش خیلی قلب استفاده شده. تنها یادم آهنگ های دل قلبم گرفت ای نازنین نفس دیگه نفس نیست. در هم یادم ولی حالا یه ماژوری میبینیم چه میشه. اومد مثل سیلاب دل دیوونم نه تنها بدونه تمام خونم یه سرگردون تنها یه مجنونم یه شب نمیدونی که تنها نمیدونی که باید نمیدونی که باید نمیشه قصه ما رو یه لحظه تنها بذاره نمیشه این وافره ما رو تو خواب جا بذاره ما رو تو خواب جا بذاره دلم از اون دلای قدیمیه از اون دلا که میخواد عاشقشو با روی دنیا بذاره با روی دنیا بذاره لا 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 That's good. Pretty close to the heart. یعنی اگر روح اوکی باشه جسمم اوکی باشه. دکتر جسم خسته رو میگن شما میتونی یه دوش آب خنک بگیری جسم خسته رو اوکیش کنی وقتی روح آدم خسته باشه یکم سخت. Am I right?
Yes.
Good.
I have another question for you, doctor.
Great.
You're privately owned and independent practice. What does that mean for patients and why did you choose it?
So I've worked in cardiology now for 17 years, and for the first 16, I was part of the large independent practices or part of practices that were affiliated with hospitals. And the problem there is you always ask yourself, who's your doctor working for? Are they working for you, or are they working for the facility of the patients? In other practices that I've been on, a lot of testing was done that was unnecessary. A lot of procedures were done that were unnecessary, all because it generated revenue for the practice. And that's not why I wanted to do this. So we decided to do this the right way.
Very good choice. So, can you have like if you have a website, address?
Yes, we have 3 locations. We have a primary office in South Austin at 4310 James Casey Street. It's right next to South Austin Hospital. We have a location in Dripping Springs, and we have a location in Lakeway. And all the actual addresses are on our website, which is www.heartdoc.care, care.com. And then we have Instagram and web and Facebook at HeartDoc Austin.
And do the patient needs referral or they just can't?
No, a vast majority of patients can just come on their own. There is a small subset of HMO insurances that may require a referral, but that's usually the exception.
So So they don't need, they just can make a call you or
For most patients, they can come and just call and come in.
that's great.
So how do they know that they need to call you? What kind of symptoms should they look out for?
A complicated question. It's a fairly broad topic, right? So are we talking about primary prevention versus secondary prevention? For primary prevention, they may have no symptoms. It's about addressing the risk factors to prevent that from happening. So in someone who may have a genetic predisposition or other family members who have problems early on, they may want to come in before the age of those people to try and prevent them following suit. If you're having symptoms and fatigue, exercise intolerance, shortness of breath, chest pain, jaw pain, or left arm pain that occurs with physical activity, skipping or racing in the heart, passing out for unclear reasons, there's lots of potential reasons that could be related to us. And just as a rule, we're cardiologists, but really we're heart and vascular specialists, because we focus on everything from basically the tip of the brain to the toes. So people who have had problems with mini strokes were born with holes in their hearts and have had problems with that. We can fix that. Circulation problems in your legs. If every time you walk across the parking lot, you have to stop because your legs burn. Those are all signs that something is going on with the circulation, and we can address all of those things because they're all related, right? Heart disease really isn't heart disease. It's atherosclerosis, and atherosclerosis affects your entire body.
In some of the things that there is a certain age that you have to start doing a screening, like for example, colonoscopy or mammogram. Is that the same for cardiology or no?
Not really, because again, there's multiple factors that go into it. So depending on your family history, depending on the risk factors, as a rule of thumb for us, at about age 45 or 50, we start sort of becoming more aware of it and more concerned, because that's about the time where things happen. Now, the problem with that is we're starting to have people show up much earlier in life with events, right?
Probably because of like the way the life has changed, less activity, less diet.
That's right. The more convenient things become, the more unhealthy they become.
The other thing I've always seen that sometimes people mistake the abdominal stomach pain with the heart problem. What's the difference between these two?
So it happens a lot. As we said earlier, heartburn, which normally suggests your stomach, isn't always your stomach. It can actually be your heart. The main difference is I went out and had a greasy meal, and 30 minutes later I had a sour taste and burning in my chest. Probably your stomach. If every time you walk across the parking lot you get burning in your chest, it's probably not your stomach.
Exactly, because I've seen people don't take it seriously. They say it's a stomach, but they have to actually take it.
So two important things, right? One is identifying the symptoms. She asked about that. Heart disease, for lack of a detailed description, is a plumbing problem. And when the plumbing is going bad, you're going to have problems when you need it most. So in the initial stages, it occurs in higher demand situations. Stress, anger, physical activity is when they notice problems. As it gets worse, it can begin to occur with little to no activity. So those are the things. And the other thing that happens is people adapt. What I mean by that is I have a patient who every time he walks fast up a hill, he gets chest pain, and he stops walking fast up hills, and his chest pain went away. He didn't fix the problem, he's avoiding the cause, right? So you don't want to do that. You want to identify and fix the problem.
So how is it important in family history that you
Very
say?
important.
Because my mom's side, most of my aunts pass away because of heart attack in young age. So what should I do? Should I getting ready to die, or should I?
You should go into your cardiologist and have your risk factors addressed, so that you don't have that. Family history is very important. Now, it's also important what you do with your family history, right? Like for example, historically, Japanese people had very low incidence of heart disease. But after World War II, a large Japanese proportion came to the United States, and we found that in those people, they had the exact same rates of heart disease as the rest of us. So genetics is important, but what you do with the genetics is equally important, right? If you compound that with a poor diet and sedentary lifestyle, bad habits like smoking, you make that worse. If you change those things, you can sometimes override it.
اجازه بدید من اینم اضافه کنم که آقای دکتر فارسی رو کاملا متوجه میشن و مریضای ایرانی هیچ مشکلی ندارن. ما این نیم ساعت یک ساعت که در خدمت آقای دکتر بودیم خیلی لذت بردیم از مصاحبت باشون، کاملا متوجه میشم و اگر کسی زبان انگلیسی رو نمیدونه هیچ مشکلی نداره و کاملا میتونن محاوره‌اش رو با آقای دکتر زبان فارسی داشته باشن.
مثل کلاس سوم ولی بعد.
نه کاملا عالی صحبت میکنم، متوجه میشم. Lena June, any question would you like to ask?
No last questions.
شما خودتون would you like to add anything to this?
No, I want to thank you guys for coming today. This has been very enlightening.
We should thank you. We really enjoyed hearing from you and all this information that you shared with us. It was very, very useful. And I'm
We're
sure
glad
our
to help.
audience enjoyed it.
Glad to help.
Alireza John.
So do you have any question for Arjun? I think we have.
Yes, I have one question because I just visited Dr. Amjadi. Really, I learned something about
علیرضا عزیز باشید با یک موزیک زیبای دیگه و بعد سوال داریم از آدینسمون بعد میشنویم.
Okay.
او وقت دیوونم بودی، همش در خونم بودی، با چشم گریون از بس قسم خوردی بلا، از بس شفتادی به پا، دلم برمت بود. از آغوشت شدم، حلقه در گوشت شدم، چراغ روشن، جلوه خاموشت شدم. گمونم یادت نره عهدی که با تو بستم، من به اون قول و قرار به پای تو نشستم. مشت تو پیشم وا شده، خونه براندازی نده، بس دیگه بزار برو با دل من بازی نده. سنگ تموم گذاشتی تو بی وفایی، به سینه داری میزنی سنگ خدایی. سنگ تمام گذاشتی تو بی وفایی، به سینه داری میزنی سنگ جدایی. من با تو بندم، خدا من با تو بندم.
من سوال کنم نمیدونم موتم یا آمود و آنمود.
بله ما الان صداتون رو میشنویم. خیلی خوش اومدی فرید جون، متشکرم. دیدین که
خواهش میکنم علیرضا.
کردم قلب تو قلب.
So you guys have my voice?
Yes, we do.
Can you? Okay. I was just saying, I'm the patient of Dr. Amjadi, and I was going to thank him for this event. Really, this is going to be very helpful for all the senior citizen people, because most of our friends, they taking different prescription for the blood pressure. I want to know what is the difference between all these? First of all, how many we have in the market right now for the blood pressure?
Hundreds.
Oh my God! Oh, okay. I don't want to tell them that. But which one is the most popular one?
There is no right medication for any one person. Again, it's usually complicated. the blood pressure medicine sometimes is important if they have other diseases like diabetes, or if they have heart failure, or if they have arrhythmias. So there's multiple factors that go into it. The most important one is which one doesn't make the patient feel bad and works. So there's lots of factors we consider. Cost is another important one, right? You can have the best medicine. If they can't afford it, it doesn't matter.
Okay, and you know what? Because sometimes some of these medication, the insurance company is not accepting.
That's correct.
And some accepting, and sometimes I used to use the name brand, but now my prescription on my company, I mean the insurance company, say no more name brand, and I have to use generic. And most of the time, the generic is not working on me. I always like that name brand, and I always thought they're gonna work more. But I don't have any choice right now because I have to go with the insurance company. You know, I want to know, is the generic really? Is it really too much different between generic or name brand, or they are really same, or we just like aftermarket, before market is something like that? It is.
In theory, all generics are supposed to have the exact same active ingredient as the brand name. In practice, we found differences in formulations. One of the problems we've had over the last couple of years is the vast majority of our generics are now made in other countries, mostly in India, and we're having problems with contamination. So they're coming over with contaminants that were leading to things like cancer. So we've had a lot of problems with generics. They're not as tightly regulated because they're not made in the US, but in theory, they're supposed to be equal. People are different though. Some people respond differently to different medications. So
what do you think about those medicines come from Canada through internet beginning? Do you think that those is trustable too or no?
So that's really a different question. People go to Canada to try and get medicines cheaper. If you are able to get your prescriptions from a reputable pharmacy in Canada, then there's nothing wrong with that, right? It's their controlled facility. You're getting the same medications at a fraction of the cost. For whatever weird reason, the corruption in the U.S. is pretty rampant, and drug costs are much higher here than they are across the border. To give you an example, there's a hepatitis drug that in the United States costs $90,000 a dose, and in Africa they charge $1,900. And the question was why, and the answer was, well, they can't afford $90,000 in Africa, so we price to the market. So you pay much more for the same drug in the U.S. Unfortunately, our government doesn't allow you to you're not supposed to be able to get drugs across the border, which is difficult. So sometimes you end up going on the black market, and the black market, there's a lot of fraud. You have to be careful of the fraud. But if you can get to a reputable pharmacy in Canada, you can get the same drug usually for a fraction of the cost.
Okay, thank you very much. I really appreciate for this information. Appreciate it.
Thank you.
You guys have a nice day.
Thank you. Thanks for
I
coming.
think we have another question from Zoom. If we can go to the next question, please.
Who? Me? I don't have any question.
Okay. But question is just, how do we lower cholesterol? Through pills or holistic medication?
So it depends. The best way to lower cholesterol is to not eat as much and exercise and control your diet. Holistic medicines generally don't work. Red rice yeast, fish oil and stuff, CoQ10 have all been claimed to have significant effects, but in actual clinical trials showed little to no benefit.
I've even heard garlic.
Garlic is fantastic. It's an antioxidant. It's a natural antibiotic. In high amounts, it keeps your friends away. It's great for food, but it doesn't really do a whole lot to change things. There's no substitute for not eating it and exercising. So within the diet, the thing that we tell folks is you have to be careful of how many eggs you eat. We've had a lot of debate as to whether they're good or bad. They've gone from being the devil to being wonderful. The current recommendation says no more than 3 per week, right? So after 3, you should be having egg whites or egg beaters.
And red meat also.
Red meat is high in cholesterol. Shellfish, shrimp, lobster, mussel, scallops, high in cholesterol. People don't know that very often. Chicken and pork has cholesterol, just not as much as red meat. Fish tends to have the least. But again, for all practical purposes, there's really no cholesterol in plants your body can absorb. So you want to try to eat more plants, less animals.
Exactly. And as you said, I think exercise.
You have to exercise.
Yeah, and because I've also seen people, they are not even obese or fat, but they have a high cholesterol.
Correct, because your body can make it. There are vegetarians who have high cholesterol.
Yeah, that's true.
And with regard to exercise, to use an analogy from my own father, walking to the mailbox doesn't count.
Yeah, exactly. Yeah. Let me add one more time that Dr. Amjadi, as I said, for Persian audience, آقای دکتر اکثر میوه ها رو میبینن و به زبان فارسی کاملا مسلط هستن. حالا ما ازشون میخوایم که دوباره مشخصات آفیسشون رو حتما در اختیار شما دوستان قرار بدن. اگر سنتون طوری هست که بالای 50-60 هستید و در فامیلی هیستوری دارین، تاریخچه بیماری قلبی رو دارین، مشکل کلسترول، مشکل فشار خون رو دارین، حتما به آقای دکتر مراجعه کنید برای چکاپ. قیمتشون خیلی مناسب‌تر از بیمارستان ها و آفیس هایی هستش که وابسته به بیمارستان هستن و خیلی فلکسیبلن، بسیار پشنتن و با شما راه میرن. We would like to ask if you can say again about your phone number, office phone number, location.
So we have three locations: South Austin, Lakeway, and in Dripping Springs. Our office phone number is 512-504-7411. Again, 512-504-7411. It's the same phone number for all three locations. So if you just call that number, we can get you into whatever facility works best for you.
I have another question, Dr. Amjadi. How does the alcohol affect the heart problem or heart disease?
So alcohol in small amounts is actually good for you. It thins your blood. It helps improve your bad cholesterol to good cholesterol ratio. Can actually protect against heart disease. In higher amounts, the alcohol itself can be directly toxic to the heart muscle. So while it may protect you from developing blockages, it can actually cause heart failure. But you have to be careful of what you put in the alcohol. For example, a margarita has a lot of sugar and salt that override the benefits.
That's true. But I heard like red wine, some people say, I don't know.
So red wine is, so alcohol actually has been shown to be good for you across the board, whether it's vodka or bourbon or wine. Some people have argued that wine also has the antioxidants, which make it a little bit better, but the protective benefits of alcohol is actually across the whole spectrum.
Nima, do you have any questions? Would you like to add anything? Okay, I have
Just take care of your heart, be a nice person. That's it.
is a question from the Zoom? Yes.
They want to know about PCSK9 inhibitors, where they fit in, or have really high LDL.
Was this your question?
No.
Okay.
This is my question.
Okay. PCSK9 inhibitors are relatively new. We've had them now for a couple of years. They are a great new tool. They are an injection that you give yourself every 2 weeks. It's very simple. There's no needles. It looks like an EpiPen. You just clean the area, press a button, and in about 9 seconds, it gives you this injection. And for a simplified explanation is basically it's a targeted missile for cholesterol. It's an antibody that sticks to cholesterol and helps your body eliminate it. They're very effective. When added to statins, you are able to reduce your cholesterol by an additional 71%. The main problem is they're expensive.
Thank you so much, Dr. Amjadi. I think we're going to hear again from Ali Reza.
Again?
You have anything that you want to play?
I don't know
We
anything.
trust it. We trust.
You want an English song?
Whatever.
Enjoy.
I wish I could. اکنون ز عشقم گریزانی همم راز چشمم نمیخوانی از این من که حالم نمیدانی پس از تو نمونم برای خدا تو مرگ دلم را نمی‌آوری تو توفان سنگین به شاخی من گل هستیم را به چین آوری که هستم من آن تک درختی که در کام توفان نشسته همه شاخه های وجودم به خشم طبیعت شکسته همه شاخه های وجودم به خشم طبیعت شکسته Really good, thank you. شنبه که من برنامه دارم نه شما برنامه دارید. شنبه ما قراره یه گروهی تشکیل بدیم از دوستان فارسی زبان و غیر فارسی زبان دف و تنبک که اگه بیان استعدادتون رو محک بزنید ببینید تا چه اندازه میتونید تو موسیقی موفق باشید. خیلی هم سخت نیست. جلسه اول آشناییه ما یکم با هم یه پرکتیس میکنیم ببینیم که میتونید مثلا که ازتون استفاده بشه برای یه گروه دف نوازی یا تنبک نوازی. حالا سازم واسهتون تهیه میکنه ولی چه بهتر که داشته باشین یا بخرین یا چه بکنین. شنبه توی لایبرتی آره تو فیسبوکمون هست آدرسش هست میتونید بیاین ساعت 11 شب 10 صبح 11 شب کم بخوابم 10 صبح میتونید بیاید اونجا که ولی آن تایم باشین. پارتی خونه شهناز جون مهناز جون اینا نیست چون کلاسه سر وقتش بیارین که با هم آشنا بشیم. ما میتونیم از توی شما یه گروه دف نواز تنبک نواز تشکیل بدیم که بتونیم یه کاری بکنیم توی کامیونیتی خودمون ازش استفاده بکنیم چون این خیلی مهمه. اگر خودتون این وال بکنید اگر یه کاری بکنید ما میتونیم یه کاری بکنیم. این گروه های فعال و فالوشون بکنید خیلی سخت نیست. لایک کنید شیر کنید کمکشون کنید اگه بتونید که مثل بقیه کامیونیتی ها ما یکم یه سری توی سر رو در بیاریم و بتونید موفق باشیم. I love you guys. Thank you که به ما گوش دادین و موضوع خودتون باشه. به امید دیدارتون. Next program. Thank you. Thank you. به خاطر دکتر بود و من برگردم همه جا نمیزدم.
مرسی از گروه آیپا، مرسی از مهناز چون که این برنامه‌های مفید رو تشکیل میدن و باعث میشن ما با واقعا خیلی it was an honor to meet you tonight. I really enjoyed talking to you.
Really.
But this program is recorded and it will be posted on our Facebook and social medias with doctor's office information, his contact number. So if you have any question or any concern, please call him and make an appointment as soon as possible.
We're happy to help anyway. If you just have questions, just we can give directions as to what to do.
Thank you so much. Sure. Thank you. It was an honor to have you tonight.
Thank you for coming.
Thank you for sharing all this information. Thank you, Lena Jun. Thank you, Alice Jun.
Thank you.
It was great. Just like always.